Hi, I'm Dr. Ashish Dutta. I'm a cosmetic surgeon. I work with Aesthetic Beauty Centre in London, Newcastle and Sunderland. The long name for PRP is Platelet Rich Plasma, but some people also use PPP, which is Platelet Poor Plasma. In our blood cells, there are various white cells, red cells and platelets. When we draw the blood, we spin it and then we take the red cells out and then we are left with plasma and the platelets. When we inject that into various parts of the body for various outcome or reasons, we call it PRP. PRP can be used for various reasons. Recently, we are using it for facial rejuvenation or skin rejuvenation. People are using it for various operative processes, like in the process of doing a facelift or even a full face and neck lift. We have used PRP for hair regeneration, and of course, we know that PRP has been used in sports injuries for healing purposes for quite a number of years. We know that the blood that we draw has got the plasma and the platelets. Plasma and platelets have a huge number of growth factors and also some inhibiting factors. Now, when we take that plasma out and we inject it into the skin, these growth factors help the skin to rejuvenate and to look fresher. These growth factors are involved in healing the skin quicker. And we have seen that when we use PRP, particularly for scars, the scars look healthier, the scars look much better within a short time. However, when we use PRP for scalp or hair rejuvenation, we find that the hair regrowth is slightly quicker, but even more important, people who are losing hair, the rate of hair loss slows down. There are quite a few papers on this, and they are available on the internet. Fortunately, PRP is a byproduct of the patient's own blood, hence the complications are very rare. However, it is injected into the scalp or the skin, hence you can get a bit of bruising, a bit of swelling, a bit of inflammation, which are again very short-lived, and the patients can usually return to their normal social activities within the first 12 to 24 hours. One thing I may add, that patients' expectations with PRP are huge because of the public advertisements, the propagandas, and I feel it is important to tell the patient that they may have to wait for 2 to 3 months to see the actual benefit. And for the skin rejuvenation or the hair rejuvenation, I tell my patients to have at least 2 to 3 treatments over the next 3 to 6 months, and that is when they see the real benefit. You're absolutely right. PRP has been used along with fat transfer for quite some time. What we find that the extra growth factors that come with the PRP helps the fat cells to establish themselves within the surrounding area much quicker, and hence the grafts last longer and the patients get a much better effect. However, there are certain treatments that are being used by various doctors, not only in the UK but also in States, whereby they are being injected into the genital area, proverbially called the P shot or the O shot. The P shot is for the penis, whereby people are getting better erection, and of course the O shot is for the injections into the lady's genital area for getting better orgasm and rejuvenating the genital parts. There are various papers available on this one, but I think the jury is out. In my hands, I have seen some patients with obtaining benefit, but most of my patients are happier with the skin rejuvenation and the scalp or the hair rejuvenation treatments, and I'm still not so convinced that the P shot and the O shot are the right way forward.